Hello, and welcome to the Public Health Shift audio edition. I'm Nadia Tekkal. In this space, I read and reflect on each issue of my newsletter, creating a pause for public health professionals to think more deeply about how we work, what we prioritize, and what the current moment is asking of us. This episode is based on issue 18, Why Good Public Health Strategies Fail in Practice. Public health strategies are often well-intentioned. They're grounded in evidence, shaped through consultation, and aligned with widely accepted goals. On paper, they make sense. And yet, many of them struggle once they move into practice. When this happens, the explanation is often framed as an implementation problem linked to capacity gaps, weak coordination, or insufficient follow-through. Of course, those factors matter, but focusing on them alone can distract from something more fundamental. In many cases, strategies fail because of a persistent misalignment between ambition, feasibility, and accountability. Ambition plays an important role in public health. It signals commitment, sets direction, and helps mobilize attention and resources. But ambition in strategies is often shaped less by what systems can realistically deliver and more by what institutions, funders, and global agendas expect to see. As a result, strategies tend to expand with more objectives, broader scopes, and multiple cross-cutting priorities. Ambition becomes visible and reassuring, while feasibility, by contrast, often remains implicit. Strategies are expected to be comprehensive, inclusive, and scalable, even when the systems responsible for delivery are fragmented, overstretched, or operating under constant pressure. Feasibility is often considered too late in the process. Instead of shaping priorities from the outset, it's treated as a constraint to manage after decisions have already been made. This includes very practical considerations such as human capacity and workload, institutional authority, coordination mechanisms, infrastructure, and time. In practice, many strategies assume that existing systems will simply absorb new responsibilities. And when they can't, the gap is filled informally through goodwill, overtime, workarounds, and quiet reprioritization. These adaptations help strategies survive on paper, but they rarely lead to the outcomes that were originally envisioned. When ambition outpaces feasibility, accountability tends to shift. Those closest to implementation, program teams, frontline staff, and local partners, become responsible for delivering objectives they didn't design under conditions they did not define. Meanwhile, accountability for whether the strategy itself was realistically scoped often remains diffuse or absent altogether. Ambition flows upward, responsibility flows downward, and learning remains limited. Failure is then described as a technical or managerial issue rather than as a predictable outcome of how the strategy was constructed. Over time, systems learn how to cope with ambitious strategies rather than how to deliver them. They prioritize what's measurable and they defer what's complex, while adapting quietly just to stay functional. What we often label as implementation failure is really the visible symptom of deeper design choices made long before delivery even began. The issue then is not a lack of vision, in public health, but rather a reluctance to fully confront limits, trade offs, and responsibility during policy development. If misalignment between ambition, feasibility, and accountability is systemic, then improving implementation alone won't be enough. Rethinking policy development means asking different questions much earlier. What can the system realistically carry? What must be prioritized and what must be left out? And who is accountable not only for delivery, but for design choices? This is a call for responsible ambition, ambition that is aligned with reality, resourced honestly, and owned collectively. Before I close, I will leave you with a few questions to reflect on. Where in your work do you feel accountable for outcomes you didn't help design? What parts of the strategies you work with rely on goodwill, informal work, or assumed capacity to function? Whose needs are most visible and whose constraints are least acknowledged? And what would responsible ambition look like in your context? Public health doesn't lack ambition, but it often lacks the space to be honest about what systems can realistically sustain. Perhaps the work ahead isn't only about designing better strategies, but also being more accountable for the conditions we ask them to operate in. Thank you for listening. If you would like to continue the reflection, you can read the full version of this issue by subscribing to the Public Health Shift newsletter on www.nadiatekkal.com. Until next time, take care and keep questioning how we show up in our work.